So we'll move on to Madam Dr. SUSHMITA KAUSHIK, who's professor at one of the leading institutes in the country from PGI Chandigarh, and we look forward to hearing from her about opportunity beyond boundaries.
Good morning, and thank you at the outset, Dr. Chitra and the ARC, for the opportunity. Can I have the slides on, please? Yeah, for the opportunity to speak. At the outset, I would say that I'm not sure whether I'm even qualified enough to talk about this, because my passion is do the best you can where you are. So I'd like you to keep this in context as the talk goes on. So the first question is, why go? You know, you've become an ophthalmologist. It's time. You probably have a small child. You have a small family. And if you're a woman, you're also a new daughter-in-law. So you want to prove yourself in all aspects, isn't it? So the two things that I see is, one is observerships and fellowships. That's one, to educate yourself, do a little more than what you're doing. And the other is, of course, that I'm doing pretty much what I want, but let me go see the world. Let me avoid being a frog in the well and think that, you know, my space is the pinnacle. And there are some, quote unquote, who would go for a better life. I don't like these pothole roads. I don't like the light going. I don't like all that. And there might be some crazy people who just want to adventure out into the new world and do something which is different. So where is this possible? Traditionally, observerships or fellowships, which are academic, these are the places where most postgraduates would look for, the UK, US, Australia, where they would want to train themselves a little more in whatever they want to do. But there's also a different sort of niche, which is the work experience. And you could go to any of these countries, but the ones which are not explored so much are Africa and the Middle East and China, which actually offer work experience in another setup, and they all, I think, work to enhance your outlook and to broaden your vision. So it's not a bad idea to just go and work in another setup to just get perspectives of what else they're doing. So we'll go on to the academic ones first. Now, these are all structured training fellowships. If you go on the website or wherever you want to go, most of them would have rigorous qualifying exams for licensing, because unfortunately they want to be sure that you are a safe ophthalmologist to be let loose into their communities. And the fellowship would usually require some amount of time which is spent working in the country once you pass the licensing requirements. So you need to work for some time before you, so for instance, as an SHO or maybe as just a registrar somewhere in Australia, if you're going, before you're actually allowed to even enroll for a fellowship. So these would vary. So I'm not going into the details, but they would vary from institutes, from states, from countries, and we need to look into that. But then you also have an opportunity to be an observer or an apprentice. There's no clinical work. It's more like job shadowing. And most hospitals abroad would allow that depending upon your CV. And it helps if when you go abroad, you latch on to someone who you think you would like to work with and talk to them. And they're usually quite all right about it. They usually shadow a particular person or a particular department. And according to institutional rules, some may be paid, which doesn't mean paid to you, but it means that you might have to pay for a fellowship or observership. And you are officially permitted to attend clinics. You will be given this I-card, which will allow you to walk through the corridors and make you feel a little important for some days. You can walk into the ORs, and you can also attend academic activities. So it's a nice overall, experience to have for a few weeks or a few months to just see the world and see how things are outside. And believe me, it will broaden your vision than what you were doing just here. And you may be permitted to examine the patient yourself once they think that you're okay. But remember always, this is the different ball game, what Dr. Ravindra was also saying. Remember, you have to introduce yourself to the patient. You have to ask permission before examining. So that's something new which you would learn. And you would see that, imagine being asked permission. Here the patient is asking permission, will you please see me? And here I have to ask permission, may I see you? So it's a different ball game. So Australia is a little different, so I just put that in. The pathways are a short term and a long term. So you have a specialist pathway, which is really long, but which makes you really settle into Australia if you really want to do that. But then you have specialty clinical fellowships, where you're a senior registrar or an unaccredited registrar jobs in general ophthalmology. Those are reasonably better to have, and it's a sort of stepping stone towards taking the RANSCO exams if you really are interested in settling down in that country. So that's one little thing which you don't see in the US or the UK. So coming to the ICO fellowships, these are important, but you need to go on to the ICO website and really search for them. As of today, this is what is available, so I've put this in. So you have multiple 3-month fellowships which are offered by ICO and its supporters, and you'll get a list every year of what fellowships are offered. And then this year you have a 3-month and a 6-month fellowship for the diagnosis and treatment of retinoblastoma. But you also have a 3-month fellowship specifically in pathology, oncology, and microbiology, which is a basic science thing. For this, you don't need a clinical licensing. So that's one. If you're interested in that, you don't need a clinical licensing to be able to take this, even in participating centers in the US or the UK. There are some long-term fellowships. The ones on offer this year are the Helmrich Fellowship and the Fred Hallows Fellowship, which are 1-year subspecialty fellowships, and you can go into what is required for that. Some of them are paid as well. The next bit is the work experience. So in the Middle East, to be a consultant, you either need a foreign degree, or you need a DM and MCH plus 5 years experience in your parent country. Without that, they don't even consider a specialist or a consultant position. And a recruitment is advertised and specifics are detailed as time goes by. So for just an example, for the UAE, once if you fulfill the eligibility for a license, they have something called a Pro-Metric exam, which is an MCQ online exam. And once you clear it, you can enter the DHA registry and then apply for jobs. So you first need to fulfill the eligibility for the licensing and then take the exam. And then once you've registered yourself, you can apply. An interesting bit which most of us don't explore is Africa. So these are the 4 countries, Uganda, Ghana, Egypt, and Nigeria, which accept Indian ophthalmologists. They're all underserved, and you have an opportunity for comprehensive ophthalmology as well as surgical work. So it can be an exciting thing to go into an unexplored continent, really, and see what is possible there. You could go to Singapore, but they require an FRCS or American board qualified for practicing. So that's one step. If you're willing to clear, you can apply in the Far East. China, you could scan for opportunities with or without the COVID. There's no special exam, but it's based upon the interview and experience, and the advertisements keep coming out. So that's another possibility. The next thing is mission attachment of volunteer work. So organizations recruit for volunteer work in underserved areas. So this could be another adventure excitement of ophthalmology if you're interested in. You have things like the Orbis, the Unite for Sight, Fred Hallows mission. So this is just a summary. This is available in a wonderful IGO article which details this out. So I've just put that in, but it's stepwise where to go and what are the exams to clear if you really want to train and get a structured fellowship abroad. So choose and do your homework, but in the end, my gray hair will talk. Plant your own garden, decorate your own soul, instead of waiting for someone to bring you the flowers. And that's why Indian ophthalmology is where Indian ophthalmology is. And the second is that the grass isn't always greener on the other side. It's greener where you water it. So just with these thoughts, thank you very much. It's been a pleasure.
Great talk, madam. Should these short-term work opportunities should be inculcated in a fellowship curriculum? Should we look like that?
I don't think it can be inculcated in the curriculum because it's such an individual decision. I mean, it's up to, you can't say that it's mandatory for you to go abroad because then your fellow might ask you who's going to pay for it. So it can be offered as opportunities which are available if you want to take. And I think what we can incorporate in our fellowship program is give them a study leave. If somebody would like to go for 4 to 6 weeks, I think we can incorporate that as a study leave, but it'll have to be very clear. But as part of the mandate of the curriculum, I don't think we can include a foreign stint abroad. That's what I think.
Thank you, madam. That was a wonderful talk.
Yeah.
One point I would like to add is, in the curriculum, I think the most important which we are lacking, either in the medical education, postgraduate education, or the fellowship education, is about the professionalism.
Yes.
That has become the topic, and the Western people are following it as a subject in their undergraduate itself. Because most of the time we make them good surgeons, good clinical competent surgeons, but understanding the excellence, the humanism, the altruism, the accountability, the good understanding of ethics, I think that chapter needs to be introduced, and that will add a little bit more to make it an entire fit it into the framework.
Yeah,
so
if I could just add in something which I believe is that the other thing we lack is standardization. And standardization into the ophthalmologist that has come out. I mean, if at the end of this talk, if there's one thing, why is it that everybody wants an FRCS or an FRC Opht or an American board qualified? Because if somebody is American board qualified, the rest of the world can take it that he knows this much. You know, he's done this. As an MS ophthalmologist, I have no idea. And I mean, being politically incorrect, even from my own institution. There are some MS ophthalmologists who I wouldn't go and get my blood pressure checked from, but they are MS ophthalmologists. So I think professionalism and all that is fine, but what we really need is absolute standardizations of the postgraduate curriculum so that if you have done an MS ophthalmology, people can close their eyes and recruit you. That is not possible. That's why we have to go around all this. Yeah. Will she bring her baby in? Will she stay? Will she get pregnant? Will she... I mean, if you're, that's what I believe.
Thank you, madam. We have our expert panelist, Dr. Meenakshi, madam. Welcome, madam.
Thank you.
Yeah.
I first apologize for... hi,
yeah,
Chitra.
you missed.
Thank you. Yeah, I apologize. I come from a small town called Chennai, and I didn't I found the Mumbai traffic daunting, and I somehow got
and
here.
And you come to the more smaller town like Mumbai?
Yeah. Well, okay. And thank you. I'm also from PGI, and I speak from the perspective of PGI Chandigarh, my MS from PGI Chandigarh. And yes, I barely knew how to measure the blood pressure when I finished. For no fault of PGI, probably I was just a naughty PG who never studied. But I speak from the perspective of someone who went to the US, did all parts of USMLE, did a residency, research fellowship, did a fellowship in pediatric ophthalmology, came back to Shankar Nethralaya, and precisely tried to bring the standardization to our residency program. I know Dr. Grover has worked very hard in this area of bringing standardization. And what you said, Srinivas, is absolutely true. So why people ask me, why did you go do a residency again? What was the need? So things like professionalism, communication skills, which are not really covered, and accountability. From the teachers as well. And because there you don't even have to pass the boards to start practicing. If you are board eligible, because that is how closely the residency training is scrutinized. So you don't have to pass any exams to actually start practicing. So I feel that is something very important we have to learn from them. It's an enriching experience. I was able to put some of it into practice in Shankar Nethralaya. Long way to go. I also wanted to add, in addition to ICO, from last year, we have this body called Ophthalmology Foundation Education Consortium, OFEC. And some of us are on the advisory panel. Basically what it is, it's a big group of educators who split away from ICO and have formed the OFEC, and the whole focus is on education. And they have come up with fellowships, just like the ICO fellowships. They also have very good modules for teachers that are ongoing. I happen to do one on communication and professionalism with two other ophthalmologists from different other parts. But this is a wonderful, wonderful resource, all for free, with questions, curriculum, videos, extra reading, and assignments to give you a certificate covering the entire gamut of ophthalmology educator, for the ophthalmology educator. OFEC, something to check out.
Very, very nicely put out, madam. Thank you very much. You covered it all in few sentences. Thank you, Sushmita, madam, for that wonderful